Hello, I'm Dr. Hassan Tawheed once again with a sensational topic as usual, three kinds of research gap. Three kinds of research gap. What are those three kinds of research gap? If we look deeper and we analyze what I'm talking about, we will notice that actually there are more than three kinds. There are actually 8 kinds of research questions because the type 2, the kind 2 has some subtypes. I hope this video will help you find research gap and understand more about the concept of research gap. So let's begin. Type number 1, the kind number 1, first kind is the idea-based gap. Idea-based gap. What do we mean by idea-based gap? Maybe you got an idea suddenly while working on a research project. Let's say you have just started to work on a research project and you got an idea. Now you started to look what has been written about this topic before, and suddenly you also noticed that wow, the idea I got is actually the gap. Wow, I'm lucky that I got an idea, and when I looked into the data I found out that this actually is the gap in knowledge. Nobody has written anything before. This is an unknown part of research. This is an unknown piece of research. This is an unknown piece of evidence that nobody has ever touched. So it is possible, it can happen. Never underestimate your mind. Never underestimate the power of your mind. The gold mine between your ears. Don't underestimate. That is one way. Or second possibility is that you got an idea, you looked into the data, you started looking into topics and articles related to the same topic, and you noticed that no, this is not the gap. It has already been covered. It will happen, right? But while reading, you noticed that, oh wow, there is a gap. After reading, you may start to notice that this should have been covered, but nobody has touched this aspect. So it is possible. So idea-based gap is number 1. Kind 2, the second type, is PICO question-based research gap. And this has subtypes. So we will talk about this. So PICO question, what do we mean by that? So PICO question is P-I-C-O-T-T or T-S, right? P for population, I for intervention, C for comparison or control group, O for outcome, and T for type of study, and T for time bound. So these are the PICO components, the 6 components of PICO question, or the most commonly used one is the 4 components, right? PICO only. T, S, or TT is optional, but we will utilize all 6 here. P for population, I for intervention, C for comparison or control, O for outcome, T for type of study, and T for time bound. So how they can help us find gaps? Population-based gap. So this is a subtype of PICO question-based gap. So P, population, is a subtype. So what do we mean by population-based gap? Let's say you are studying a topic related to COVID-19, for example. This is the most commonly discussed topic nowadays, so I'm giving an example of COVID-19. Let's say you are studying papers or articles related to how people behave during COVID. So you noticed there are thousands of articles, but you noticed that 95% of articles just talk about women. So you found a gap. Okay, male patients are ignored. That means I can focus more on male patients in my study. You found a gap. Maybe you noticed that there are studies, 80-90% studies focused on male patients, not on women. So you got an idea now. You got the gap. You found the gap. Women. You need to focus on women's studies, female studies. Or you notice that male and female patients are discussed, but animals are not discussed when it comes to COVID. So you said, okay, COVID, animals and COVID, animal, we found a gap. So we need to study animals in COVID. We need more research on animals who are affected with COVID, how they are affected, why they are affected. The next thing, maybe you have male and female adults discussed, but children are not discussed enough in literature. So now you found a gap that, okay, we need pediatric studies. We need studies on children. And in children, maybe there is more focus on male children, but female children are ignored. Maybe we can focus on female children. Or maybe when it comes to gender, maybe there is dearth of evidence on transgender population who does not identify themselves with any gender. Is there a possibility? Absolutely. That's a gap. You can focus on transsexual, transgender population and COVID. So see what is available in the literature. What are most papers talking about? Are they male patients, female patients, transgender? Are they male children, female children, transgender children? What exactly is the data talking about? Are they talking about animals? What is missing? What studies are least discussed? That's your gap. Congratulations. Now jump to the next part of PICO. Second subcategory, subtype is intervention. In PICO question, the I was intervention, right? So look at the studies. COVID patients who take vaccine. Vaccine is an intervention now, let's say. So you notice that there are so many studies about intervention. Vaccine, studies on vaccine. So you notice that there are a lot of studies on vaccine and COVID, but there are very few studies on antiviral medication, pill, or antiviral injection. You notice that, okay, there are studies on vaccine and pill, but there are very few studies on injection. So you can focus on IV medication, or you can focus on pill-based medication. Or you notice that there are so many studies on IV and pills, but there are no studies available, or very few studies available on vaccine. Although we know there are so many studies on vaccine, but I'm just giving an example. That's how you find gap. Replace COVID with any other disease and you will understand whatever your topic is. See how easy it is to find research gap now? And people say that finding research gap is so difficult. No, it's not. You just need to read what is available on the topic and apply what I'm talking about here. The third thing is comparison or control group. See, what are they comparing it with? Are they comparing it with influenza virus? So you know, okay, influenza virus is covered, but it is not being compared with other infectious diseases. So you got a gap now. You can write a paper on comparison of COVID-19 with Haemophilus influenza, the bacterial, not the viral influenza. Or you can compare it with symptoms of tuberculosis versus COVID. So see, what is the gap? Comparison can give you the gap. And what about the control group? You notice that, okay, they have a placebo group, but they don't have a group of market drug, patients who are taking market medication, market drug. So you notice that the studies are talking about control group, which is healthy patients, but there are no studies on, or very few studies on placebo. So you can focus on placebo. Or you notice there are studies on healthy patients and placebo, but you notice that there are no studies or not enough studies on market medication. So can it happen? Absolutely. So that's why look at P, the population. It can help you find the gap. If not, look at the intervention. It can help you find the gap. If not, then look at the control or comparison. It can help you find gap. Now, what is the fourth thing in PICO? Outcome. Look at the outcome. One outcome is discussed. Could they cover any other outcome? Is there any outcome that is missing? Absolutely. You can look into that. Now, the two T's or TS, type of studies. Some people use S instead of T for type of study, which makes sense. So you can use S. So study. What is the study design? Do you see most papers that are published are actually clinical trials? That means animal studies are missing. If more studies are animal studies, then human studies are missing. If more studies are animals and clinical trials, then that means possibly cohort studies are missing. Observational studies are missing, or maybe randomized control trials are done, but non-randomized are missing. So type of study is a big indicator of the gap. What is the gap? You can just focus on one particular type of study and you can further explore and do your project. Now, the last T is the time bound. It could be of two types. That when was the last time a paper related to this topic published? Was it published 2 years ago? That means it's a big gap. Was it published 5 years ago? That's a huge gap. Was it published last month? No, then it's not a big gap. What about the other way of time? How much was the follow-up? After the outcome, after the intervention was given, between the outcome or after the outcome, how long was the follow-up? Do we have more studies on 6 months follow-up? That means we need studies on 1 year follow-up. If we have more studies on 1 year and 6 months follow-up, that means we need study on 5 year follow-up. See how the time can help you find research gap? That's how you find research gap. So now what we have discussed so far, we have discussed the idea-based approach, idea-based gap. We discussed the PICO question gap, and we discussed all 6 types: population, intervention, comparison, outcome, time, and the type of study. Now, what is the last type? What is the last kind of research gap? Contradiction-based research gap. Contradiction-based research gap. What do we mean by that? Let's say there is a topic in which there is a confusion in result. Some studies say that XYZ medication treats patients, but some studies suggest that no, this medication actually worsens the condition of patients, can actually kill the patients. Now you are confused that you have 2 kinds of data. Now this is a gap, because there's contradiction. So you can say this is gap. We don't know exactly what is happening. That's what we are trying to explore now in our research. This is a wonderful situation that you can now focus on one of those topics and explore further as the gap. So this is how you can find your gap if you understand these 3 kinds and the subtypes. So I'll repeat again quickly. There are 3 types of, or 3 kinds of research gap: idea-based gap, PICO question-based gap, and the contradiction-based gap. The PICO-based gap has subtypes: population. You can look into population, male, female, animals, any other gender, or I for intervention. You can see IV, medication, pill, or inhaler. What kind of intervention is missing in most of the papers? So you can focus on that as a gap. Then the control and comparison group. Then the outcome. What are more studies talking about the outcome? What kind of outcome? which outcome is missing, what you can focus on. And the next thing is the type of study. What kind of study design is least studied? That's a gap. What timeline? How many years ago last study was published? Or how long the follow-up was? What follow-up can you focus on? Maybe 5-year studies are missing. Maybe 1-year studies are missing. And then the third was the contradiction based. That if there is a disagreement in the literature, some studies say that this medication is good, other studies say this medication is bad. Now you have a gap again. So thank you for watching this video. I hope this video helped you. And if you have any question, please comment below. I will try my best to come and reply to you as soon as I can. Thank you. Keep learning. Keep watching.